What if looking like a pumpkin for 3 days meant better skin for the next year? A few weeks ago, I filmed my entire RF microneedling and laser resurfacing procedure from start to finish. I'm going to show you the numbing process, what the treatment actually feels like, and what my recovery looked like. Stay tuned until the end, and I'll break down the cost and how often you should do this and the questions you need to ask before booking. Before we jump in, RF microneedling uses tiny needles that deliver radiofrequency energy deep into your dermis to trigger collagen production and also elastin. I paired it with LaserMD Ultra for texture and pigmentation. You're gonna see the entire experience unfiltered, the numbing, the treatment, the swelling, all of it. Please consider sharing this episode with anyone you know that's interested in RF microneedling. So it's super early. I've already had a little bit of breakfast, which is unusual for me, but I don't want to go through this without any food on board, so that's really important. I'm also wearing loose clothing. I have like these V-neck on because I'm going to do my whole face and then my neck, and we generally go down to the clavicles. Not an advertisement for Brandy, but I do love her music. I'm going to pause now and grab the anesthetic. It's now about an hour and 15 minutes before my procedure, and I am just applying topical anesthetic to my skin. It's mostly on there already. I realized I couldn't do this in front of a camera, so I had to do it in front of a mirror. This is 23/7, so this is 23% lidocaine, 7% tetracaine. And anesthetics are not all the same. So first of all, to do this procedure, you really need a very, very powerful topical anesthetic that most places don't have. So any place that doesn't have a doctor can't get it, number one. But number two, they're not all the same. Even if you get a 23/7 from somewhere else, they don't all absorb into the skin at the same rate, the same ability. So I've tried many, many different ones, and I finally found one that really works well. And I've continued to try some other ones, and they just don't work as well. I had one real painful one. But so basically, you have to put it all over the skin, right up to the hairline. Otherwise, that really hurts. And then up to the ear and the earlobe right there. We tend to go from the earlobe down to the clavicle. The way this procedure works is you're using needles that are going into the dermis and zapping the middle of the dermis, which would be really, really painful if you weren't super numb. So that's why we numb for all this time, hour and 15. I don't know why. I mean, an hour and 15 seems to work the best for us. We've tried an hour. It seems like maybe it's not enough. We've tried an hour and a half. That hasn't seemed to make much of a difference. So that's generally what we do, hour and 15 minutes. And the vast majority of people are ridiculously numb with that. I have a pretty low pain tolerance. It's hard for me. I'm pretty much an outlier. So you'll see what it's like for me to have this treatment. It's not too bad. It's not pain-free, but it's not intolerable either. So I'm in my office now, and it has been about 45 minutes since I put the anesthetic on my face. I'm now kind of rubbing a tiny bit more in because the anesthetic that's right up against your skin, that layer, right, is what's getting absorbed. And so if you rub it in about halfway through, it actually is a lot more effective. We've been doing this procedure now for 11 years, and we have found that works really well. So that's what I'm doing right now. I got a mirror, and I am so numb already. It's crazy. So I can't feel much of this, a little bit kind of deep, right? But at the surface of my skin, I can't feel much. Okay, so we are getting into position here. I haven't quite started, but my face is ridiculously numb. I can't actually feel my upper teeth hardly. So we are going to get started in just a minute here. So we are turning on the chiller. It's gonna blow cold air. You'll hear that in the background. So in addition to the topical anesthetic, the cold air makes it feel better as you do the procedure. So this is that cold air device. It's going to blow cold air. She's just wiping off the anesthetic now. This is Kim, by the way. So Kim is a nurse practitioner who has been with Glow Medspas for just over 2 years now, right? Or almost 2 years. So very exciting. And she's done too many of these to count, so I don't know. We are about to start. I'm going to close my eyes. So we do small areas of the skin, mainly so that they will be numb. Okay, good. So she's starting. I can sort of barely feel that right now. It's a little bit. I can feel a little, but yeah, it's not much. So we're almost done now. I have to say this has been like really, really easy. We have updated our protocols recently, and I don't know, it's kind of awesome. We've done my whole face and neck, and we're just finishing up my segmentum here. And when we're all done, we will do a Lays MD treatment. So we're going to start the Lays MD. So most of the time we do this right after Genius. So it's a little bit spicy. It's not terrible. Definitely the air helps. So at the end here, the skin feels really pretty hot. Like the cold air feels very soothing right now. Usually that dissipates over about 10-15 minutes. So a lot of times I especially really like the cold air blowing on it for a few minutes afterwards. It feels really good. But the skin dissipates heat really quickly, so that goes away pretty quick. So that's the growth factor serum, BGF on. So it actually feels nice and cool. That feels really good. You can tell my skin is pretty darn swollen right now. So the swelling usually, for the most part, goes away in the first 24 hours or so, especially if you eat super clean. So salad, protein, vegetables, usually that swelling is for the most part gone the next day. If you go home and eat pizza and beer for dinner, you're going to still be like a pumpkin the next day. So I always tell people that. It's not going to prevent the results from happening, but it definitely adds to the downtime. So this redness generally lasts about 3 to 5 days, but you can go back out into the world. Really important to put some sunblock on if you're gonna be exposed to the sun at all. There you go. So wow, I'm so swollen. I think I am more swollen now than I have ever been after one of these procedures. Hey everyone, I am back in my office. I just got back from the procedure. As you can see, my skin is pretty swollen, especially my nasolabial folds look insane right now. But a lot of the redness has already faded quite a bit and I feel fine. Well, it has now been just over 24 hours since I had the procedure. I just got out of the shower. You can see that my skin is still a little bit red. You can see where the line goes to normal skin and my décolleté. I'm a little bit swollen still. My eyes are a little bit puffy, but it's a lot better than it was yesterday. And if you go up super close, you can see there's a bunch of little teeny tiny little dots from the laser procedure, and that those will slough off over the next 5 to 7 days or so. So it feels like sandpaper a little bit. Mostly people can't see that from far away. I personally tend to get a few little whiteheads from this. I had a few this morning when I woke up. Those are very, very superficial. Occasionally I will get something a little bigger than just a little whitehead, but for the most part, this is kind of the deal. It's pretty easy to like go back into your normal life afterward. All right, now that you've seen the whole process, here's everything you need to know if you're thinking about doing this. So first of all, what does this cost? That's a really actually quite difficult question to ask because the prices range hugely out there. So first of all, it ranges based on where you live and how expensive your city is, but also the quality of the service you're getting and who's doing it. So it's going to be a lot cheaper going to an illegal place than a place like mine where a doctor, a nurse practitioner, or a PA is doing your service. So I'm just going to tell you ballpark prices in a place like mine. The Med Spa Board certifies med spas that prove they're doing things right. Legitimate supply chains, proper licensing, real medical oversight. It's the difference between guessing and knowing you're safe. If you're looking for treatments, go to medspaboard.com to find certified med spas near you. And if you already have a med spa you love and they're not certified, send them our link. And if you're a med spa owner doing things right, get certified and show your patients you're not cutting corners. So to do just the face alone, we usually do a series of at least 3. And so face alone is on the order of magnitude of about $3,000 for 3 treatments. So around $1,000 a treatment. That's not going to include the neck or the laser resurfacing. Those are add-ons. It costs a little bit more, but not a ton more to do those things because we try to make it like reasonable to do what we think is a full treatment. So count on anywhere from maybe 3,000 to 5,000 in your area if you're in a big city for a series of 3. Okay. Now, let's see. Why Genius versus other RF microneedling devices? Now, there are actually several that I think are really good devices at this. I chose Genius because, first of all, they're insulated needles. They're not uninsulated needles. Makes a really big difference. There are still some devices out there that use uninsulated needles, and those create a lot more damage. They're a lot more high risk. There are quite a number of lawsuits from those. Most modern devices use insulated needles, though. Their mechanisms are different, and it's really hard without getting into the physics of it why I like Genius best. But let me just say that the way they deliver the RF at the tips of the needles is basically the same amount of energy over all the needles. Each tip has 49 needles that goes in at the same time. I know that sounds like a lot. That's why we numb you like crazy. And honestly, most of the manufacturers have a similar size tip, although some have bigger ones and they're wider apart. Some have smaller ones and they have fewer needles. And the delivery of the energy, in my opinion, should be even throughout all those needles. And I will tell you that many of them are uneven. So it looks more like a square with concentric dots where they're stronger around the outside and weaker on the inside. I don't like that. But there are several devices that are just fine. I also really like the motor on the Genius. It gives a really very precise control of the depth of the needle. And that is really important for a precise treatment. So you don't go too deep and kill the fat, and you don't go too shallow and damage the epidermis in a way that makes recovery much longer. So I like Genius. There are several other manufacturers. And honestly, if you're going to someone you really trust and they can explain to you why they love their device, I think that's totally reasonable. How often do you need one of these treatments? Well, need is a big thing. Okay, so does anyone really need it? No, you're going to survive without this. But ideally, if you are going for skin tightening and you've never done anything for your skin before, we generally recommend about 1 per decade of life that you've lived. So the year I turned 50, I did 5 of them. And we separate those by about 1 to 2 months. So it took me most of that year to get those 5 treatments done. If you take a picture today before you've done anything and you have a whole series of treatments over, 4 to 10 months or longer, if you take a picture 6 months after your last treatment, I can guarantee you're going to see a difference. It just is very slow. It's not noticeable for your friends other than immediately when you're all red and swollen, but you will slowly age backwards. It's kind of cool. So, and then what about maintenance? How often do you have to do that? Well, I do one every 6 months. The results on your fibroblasts that make the collagen for you, this procedure tends to stimulate those for about 6 months. And so for me, I do it every 6 months, keep my fibroblasts awake and making collagen for me. The downtime is generally 3 to 5 days. Not too bad. It does get easier as you go. So in the first one's kind of the worst. I think the worst one for me was about 5 days of downtime the very first time I did it. But frankly, it gets easier and easier. And now, as you can tell, you can kind of barely tell. My skin is just a little bit pink and a little bit swollen next day. Another question I get a lot is, can you cover it up with makeup? And the answer is yes, but it has to be a very pure mineral makeup. There are very few really good makeups on the market. Most makeup has a lot of gunk in it that's going to give you a rash or breakout or other issues in healing. So we use a specific brand of makeup to cover up after Genius. It's called Jane Iredale. It was originally developed for dermatology offices for post-procedure. It's the purest mineral makeup you can buy. I do not have any stake in Jane Iredale makeup. They don't pay me any money to say that. It's the only one I personally trust post-procedure. As far as results timeline, as I said, your best result is going to be 6 months after your last treatment. So most people do notice some results after the first treatment. I think definitely after your second or third treatment, you'll be able to tell a difference. The change we're producing here is a very slow change in your skin. I personally, when the first year I did it, it really was halfway through that year before I really could tell. And by the end of that year, my 50th birthday, it was pretty awesome. And I just had my 58th birthday a couple days ago. So this is, and I got no makeup on. So whatever, this is what it does after, 8 years of treating it. Who can do this safely is another question I get. If it's done by an expert and who really knows what they're doing, really any skin type can have this done. We have done patients of every single skin type and have not had a problem. If you do have a darker skin type, then we do pre-treat you with some topicals to prevent any possible hyperpigmentation that you could have. In the 11 years that I personally have been doing this procedure on patients, we have 5 or 6 who have had a temporary hyperpigmentation that went away eventually. Nobody wants that though. Nobody wants it. So we try to prevent that. I've never had any permanent hyperpigmentation in a patient with this procedure. So questions to ask any place you're going to before you book this procedure. So who is performing it and what's their license? Okay. What's the numbing protocol? Because I can tell you this thing is really painful if you are not numb. So make sure you're going to an actual medical provider who can provide you real medical grade, very concentrated anesthetic. Otherwise, this is going to hurt. Okay. Ask to see before and after pictures. A lot of people depend on before and after pictures. I think it's helpful to know that the place you're going has them and has experience with enough patients to produce some before and afters. But frankly, most of the places you see out there, I'm not sure I trust their before and after. So, but if you found a provider and you trust them, then I would want to see those. And I would really ask them about complications. What do you do to prevent complications? What have you seen? And have you ever seen fat loss or have you ever seen scarring? In my practice, we have never seen these things. And I know that there are some lawsuits out there from different devices. Again, I don't think it's the one we use, but I would just be careful and make sure if they say, oh, well, we've seen that a few times, I would be a little bit concerned because they really shouldn't be seeing that with this kind of procedure. So is it worth it for you? Well, for me, it's definitely worth it. I just came back from vacation 2 days ago where several strangers who are in their 50s guessed my age, way younger than I am. So for me, yes, totally worth it. So that's the full microneedling experience from start to finish. I hope this helps you make a smarter, safer decision for yourself. Let us know if there's another procedure you'd like me to walk you through. And remember to subscribe.